Dr. Brandy Kelly. I'm a clinical psychologist and the clinical director for Louisiana's Office for Citizens with Developmental Disabilities. Today, I'd like to talk a little bit about the applicability of cognitive behavioral therapy, or CBT, for individuals with intellectual and developmental disabilities, or IDD, including autism. I'd like to start out with the basic fact that first-line treatments work for most individuals. This is easy to understand when we talk about medical health treatment, but this also applies to mental health treatment. Just like when a physician accounts for someone's age or weight, some personalization or adjustments may be needed. So what I'd like you to know is that the applicability of cognitive behavioral therapy for people with IDD just needs a few modifications to personalize it and make it effective for the individual. Other modules cover the typical in-session modifications, so this module will focus on therapy homework. And you may find that some of these modifications would and could be used for individuals without IDD as well. When you engage in CBT with any therapy client, completing homework and keeping thought and mood logs can be meaningful components, and these can be important for individuals with IDD as well. You may need to make some modifications so the person is able to complete the homework and use it in later therapy sessions. 2 simple modifications can be made so an individual is able to do these components. First, categorizing the pattern as, for example, discounting the positive, or getting the right label is not necessary. The focus can just be on positive thoughts or negative thoughts. When planning homework assignments, labeling of the distorted thought is not a necessary component. You can adjust any homework requests or tools you use to remove this aspect if the person is not able to complete this part. Second, numerical ratings are used on some tools to report mood and anxiety or worry. Remember that there are also options for visual representations of ratings, and for some people, these may be more meaningful and may even help the person to complete the homework. Symbols or pictures can be helpful in these instances. Remember that the primary goal focuses on if the person can recognize the negative thoughts linked to negative mood or worry, and then over time, learn to counter it with positive thinking, resulting in feeling better. Because the person may receive help from family, friends, or paid provider staff, the person may also need help with homework. But this should not result in any assumption that homework then cannot be completed or helpful. Remember that help from supporters is okay, as long as they also receive guidance on expectations and are able to assure the information reflects the person's information. When the person is able to tell someone what to put on their log, but just struggles with completing it themselves due to either challenges with writing or vision, then a supporter can assist them in completing the homework. The person should identify who they would like to help them, rather than just having that assigned to someone. They may be more comfortable discussing their feelings and thoughts with some people as opposed to others. If the person needs a lot of prompting in therapy sessions, you will need to be sure to share the appropriate amount and type of prompting that may be needed if someone will help them with homework. Some examples of possible support or prompting needed include: the person may need a prompt to consider that a negative thought is occurring, either by asking about past negative thoughts and inquiring if the person may have had the thought that day or shift, or if a negative thought is shared, the staff person may need to reflect back to the person that they should use their homework sheet to record it and then proceed to the next steps. Another example is the person may need prompts for each facial cue and what it means so they can choose the appropriate rating. They may also need some suggested alternate positive thoughts that have been developed in therapy. Finally, general prompting and reminders may be needed throughout the day to do homework if trying to look back at the whole day or the shift is too difficult. Each person will be different in terms of the amount of help or prompting that may be needed. Use your time with the person in session to gauge the help needed and prompts that may work, while still allowing the homework to reflect the person's progress and ability to use the techniques in the CBT approach. Now we're going to spend a little bit of time talking about how to adapt a mood log and an anxiety log. A typical mood log may be presented in a tabular format and includes spaces to log 5 things. 1, the negative thought. 2, the cognitive distortion label. 3, a numerical mood rating. 4, a replacement positive thought. And 5, the numerical mood rating, which becomes the new rating after using the replacement positive thought. When the client completes the log, it allows them to see and later review with the therapist the impacts of the negative thoughts, along with any impacts of using positive thought replacements. The therapist can see if the person is able to distinguish, identify, and use replacement positive thoughts, as well as looking at the specifics of the types of negative thoughts and impacts the person is experiencing. The content of the mood log can then guide what is discussed in future therapy sessions and where more work may be needed. It also provides information on progress in therapy. That is, the person may struggle more in the beginning to identify replacement positive thoughts, and the numerical mood rating may not change much in the process, whereas this may improve over time. The typical mood log can be modified to use simple wording, remove the cognitive distortion label portion, and shift from numerical mood ratings to the use of facial expression linked mood ratings. So a modified tabular form may include the following 4 components. 1, sad thought. 2, a facial expression mood rating. 3, happy thought. 4, the facial expression mood rating, which becomes the new rating after using the happy thought. The adapted log is then used in the same way that the typical mood log would be used, to guide discussion and get areas to practice in therapy sessions. Similar changes can be made for a typical anxiety log. Instead of using a more typical format to log the negative thought, cognitive distortion label, replacement positive thought, and numerical ratings of anxiety or worry, a modified log with simple wording and facial expression rating options can be used. The anxiety or worry log is used similar to a mood log in future sessions, but the focus is on different emotional presentation or symptoms. If the individual needs assistance in completing their mood or worry log, simply provide guidance to any supporters on how to use the log and the best ways to prompt completion. Also, highlight things they will want to avoid in providing support based on what you learn about the person. For example, if the person seems to want to please others or will acquiesce easily, then supporters will need to remember not to give their opinion about what is included in the log and limit prompts to simply reminding the person to complete or providing questions that then prompt the person for each of the 4 components. Any guidance should be individual specific, since each person will need different types and amount of support. Homework may also include practicing strategies to reduce intense emotions. Using the CBT strategies to modify thinking and switch between negative and positive thoughts is not possible when someone's emotions are very intense. Anytime we feel very sad or very anxious, our ability to use rational thinking skills becomes challenged. For each person, you will need to help the person identify what calming techniques work for them and how they can use them. If someone needs help with these, you will want to be sure that those who support the person know what these techniques are and that they practice these with the person. You will then want to be sure that the supporter knows when to prompt and assist in using these calming techniques versus the core CBT strategies. People with IDD experience behavioral health issues at rates higher than the general population. They benefit from the same evidence-based therapeutic interventions, such as CBT, which are used for people without IDD. The provision of CBT for people with IDD is not related to a niche area that requires years of specialized training. Rather, it is a cultural competency on the part of the therapist that typically requires only common sense modifications, which do not impact the core values of the intervention. This session focused on use and adaptation of homework in CBT. There are other modules in this series that may also be helpful for you to view. Thank you for taking the time to listen to this brief presentation.